COVID-19 expenses can quickly add up, especially if you're a long hauler still dealing with side effects even after recovering.
Yeah, but what happens when insurance companies are no longer waiving those COVID-related visits to the doctor's office? Arlena Salzbank has been looking into that. She says it's already happening. She's joining us live tonight with more on that.
When COVID-19 tore through our country, many insurance companies waived certain fees like hospitalization fees and also COVID testing fees. But a new study is showing that some of these insurance companies are starting to drop that waiver. The Kaiser Family Foundation found that waivers covered a combined 88% of enrollees who were looking for treatment or coverage related to COVID-19. But a more recent analysis showed most of these waivers have expired, with even more set to expire in the fall. Daphne Sanville is what we call a long hauler after being diagnosed with COVID-19 last July.
My mom and I were admitted to the hospital for 10 days. My mom was in there for 12. And it was like the worst experience you could ever imagine.
The economic manager still has symptoms, and her frequent visits to the doctors are covered, at least for now.
So this is something that isn't going to just like go away within, the next day or so. It's something that my doctors say, it's just going to take time. If ever, just keep doing memory exercises and vitamins and things like that. I can go to my doctor now and say, this is a checkup due to COVID, my hospitalization a year ago, and that copay is waived.
However, a collaboration between researchers at both University of Michigan's Medical School and Boston University suggests out-of-pocket spending may cause a heavy burden for patients in 2021 if insurers allow waivers to expire, as many chose to do early 2021.
That's definitely concerning to know that I may have to get something major done and it's not going to get covered.
Sanville is still covered under her insurance, but after being billed incorrectly during her 10-day hospital stay, she can't imagine what life would be like without a waiver in place covering hospitalization fees.
It was like $76,000 and change. All of it was covered.
CBS 12 News reached out to Lois Frankel's office to see if the federal government will be stepping in to assist families as we head into the fall of 2021. Representative Frankel said in a statement, thanks to the Affordable Care Act, pre-existing conditions are still covered, including COVID-19, long-term health effects, and we are working to expand access further in the upcoming Build Back Better infrastructure package. The Department of Health and Human Services received $186 billion to support hospitals and other health care providers impacted by COVID-19. Here in Florida alone, providers have already paid out $5.1 billion for people that were going to the hospital or for other COVID measures. In Boynton Beach, Lena Salzbank, CBS 12 News.